I am Dr. Shamoli Saha, Senior Lecturer, Department of Microbiology. Today, I will discuss about the pathogenesis and host defense. Second part. Part 1 I was discussed in my previous lecture. Before going through, determinant of the bacterial pathogen. Number 1, transmission, adherence to the cell surface, invasion, inflammation and intracellular survival and toxin production. There is some important mode of transmission. Human to human, non-human to human. In human to human, there are direct contact, non-direct contact, transplacental and bloodborne. Transplacental cause like syphilis, bloodborne also syphilis. Non-human to human, soil source, tetanus, water source, Legionnaires disease, animal source directly via insect vector and via animal excreta, and fomite source. Vertical transmission of some pathogens are transplacental within the birth canal at the time of birth and breast milk. Transplacental transmission may occur in Treponema pallidum, Listeria monocytogen, cytomegalovirus, parvovirus B19 and Toxoplasma gondii. Within the birth canal or at the time of birth, Streptococcus agalesi, group B Streptococcus, E. coli, Chlamydia trachomatis, Neisseria gonorrhoeae, herpes simplex type 2, hepatitis B virus, human immunodeficiency virus, Candida albicans. And bacteria and virus can transmit through the breast milk are Staphylococcus aureus, cytomegalovirus, human T-cell leukemia virus. Disease transmitted by foodborne. Diarrheal disease, gram-positive cocci, Staphylococcus aureus, gram-positive rod, Bacillus cereus, Clostridium perfringens and Listeria monocytogens. Gram-negative rods like E. coli, Salmonella, Shigella, Vibrio, Campylobacter jejuni. Non-diarrheal cause, Clostridium botulinum, Vibrio and Brucella species, Mycobacterium bovis, which is transmitted through the milk. There are some zoonotic disease which transmitted from animal to human, Bacillus anthracis, Listeria monocytogens, Bartonella hanseli, Brucella's other species, Campylobacter jejuni, Salmonella enteritidis, Mycobacterium bovis, Borrelia burgdorferi, Leptospira, Chlamydia, Rickettsia and Coxiella. Now, adherence to the cell surface is mediated by some specialized structure like pili, capsule or glycocalyx. They allow them to adhere to the surface of the human cell, thereby enhancing their ability to cause disease. The various molecules that mediate adherence to the cell surface is called adhesive. What is biofilm? After bacterial attachment, they often form a protective matrix called biofilm consisting of various polysaccharide and protein. From especially on foreign bodies such as prosthetic joint, prosthetic heart valve and intravenous catheter, but they also form a name structure such as heart valves. Biofilm protect the bacteria from both antibiotic and host immunodefense such as antibodies and neutrophil. They also retard wound healing resulting in chronic wound infection, especially in diabetes. Now, quorum sensing. Pseudomonas in the lung of the cystic fibrosis patient in the formation of dental plaque and the precursor of dental caries. The production of biofilm by bacteria is controlled by the process of quorum sensing. In quorum sensing, the bacteria grow in a non-aggressive manner until a quorum is sensed. A certain density of the bacteria has been reached. At the point of synthesis of new bacterial virulence factor, like biofilm that contribute to pathogenesis formation. How biofilm develop? Plankotic bacteria like free living bacteria attached with any surface formation of microcolony and ultimately causes quorum senses that produce biofilm community. Now, invasion, inflammation and intracellular survival. Invasiveness is mediated by several enzymes such as collagenase, hyaluronidase. Collagenase and hyaluronidase immunoglobulin A protease produced by gonorrhea, Haemophilus influenzae and Streptococcus pneumoniae. In addition of these enzymes, several virulent factors contribute to invasiveness by limiting the ability of the host defense mechanism, especially phagocytosis. Bacteria can cause two types of inflammation, pyogenic inflammation and granulomatous inflammation. In pyogenic inflammation, it produces pus, neutrophils are prominent, gram-positive and gram-negative cocci. In granulomatous inflammation, macrophage and T cell are prominent like Mycobacterium tuberculosis. Intracellular survival enhances their ability to cause disease, commonly causes granulomatous lesion in Mycobacterium, Legionella, Brucella and Listeria. Before that, it causes inhibition of the fusion of phagosome with the lysosome, which allows the organism to avoid the degradative enzymes in the lysosome. Inhibition of acidification of the phagosome, which reduce the activity of the lysosomal degradative enzymes. Escape from the phagosome into the cytoplasm where there are no degradative enzymes. In this procedure, a microorganism can escape the immune system of the host. Here the process of phagocytosis, bacterium become attached to the membrane, evagination of the bacteria by cellular membrane and formation of pseudopodia. Bacterium is ingested forming phagosome. Phagosome fuse with the lysosome. Lysosomal enzyme digest the captured material. Digestion of the product and release from the cell. Mechanism for escaping the phagocytic clearance and intracellular survival of the microorganism. Inhibit the opsonization and inhibit chemostasis and kill the phagocytes, and this cell inhibit the phagocytosis. After phagocytosis, when it kill the microorganism, this is inhibited by the Mycobacterium tuberculosis, which inhibit the lysosomal fusion and ultimately escape lysosome and grow in the cytoplasm. Now toxin production. There are two types of toxin, exotoxin and endotoxin. Exotoxin are produced by the several gram-positive and gram-negative bacteria. The essential characteristics of the exotoxin is that they are secreted by the bacteria and polypeptide in nature. Endotoxin are integral part of the cell wall of the both gram-negative rods and cocci. Endotoxin is a component of the cell wall and polysaccharide in nature. Here the exotoxin, which is produced within the cell, and this is the endotoxin, which is produced from the cell membrane. There are the difference between exotoxin and endotoxin. Exotoxin produced from the gram-positive and gram-negative bacteria, whereas the endotoxin is produced from the cell wall of the gram-negative bacteria. Exotoxin are polypeptide in nature, whereas the endotoxin is lipopolysaccharide in nature. Exotoxin mainly present in the plasmid or bacteriophage, whereas the endotoxin mainly present in the bacterial chromosome. Exotoxic are highly toxic and endotoxin low. There are some clinical effects and various types of mode of action are produced by the exotoxin, and endotoxin produce fever, shock. Exotoxin produce high titer antibodies and endotoxin are poorly antigenic. Exotoxin are toxoid used as vaccine and no toxoid from and no vaccine available in case of endotoxin. Exotoxin are heat stable, destroy. Exotoxin are not stable in heat, destroy rapidly at 60 degree centigrade temperature, but endotoxin are stable at 100 degree centigrade temperature for 1 hour. Example of exotoxin producing bacteria: tetanus, botulism and diphtheria, whereas meningococcemia and any kind of septicemic infection produced by the endotoxin. This is the immunoresponse of the exotoxin. Activated exotoxin, after application of heat, it becomes deactivated. If not deactivated, then it causes bind with the exotoxin receptor of the somatic cell and it produce different type of disease. Mechanism of action of bacterial exotoxin. It can causes ADP stabilization in case of diphtheria toxin, cholera toxin, E. coli heat level toxin and pertussis toxin. It acts as a super antigen in case of toxic shock syndrome toxin and Staphylococcus enterotoxin. It acts as a protease in case of tetanus toxin, botulinum toxin, lethal factor of anthrax toxin and scarlet skin toxin. There have also a mechanism, it is lecithinase, is produced by the Clostridium perfringens alpha toxin. This is the overall procedure how the exotoxin is work. It is a super antigen where T cell receptor bind with the MHC class 2 molecule and super antigen bind with the T cell receptor and MHC class 2 and activate the super antigen. It is the mode of action of endotoxin. Endotoxin, especially lipid A, activate macrophage, activate complement and activate tissue factor. Activated macrophage release interleukin 1 which causes fever. It releases TNF alpha, it causes fever and hypotension, and it releases nitric oxide, causes hypotension. Activated complement produce complement C3A and 5A, causes hypotension edema, and C5A causes neutrophil chemotaxis. Activated tissue factor activate the coagulase cascade and produce disseminated intravascular coagulopathy. Ultimately, patient develop shock. This is the cytokine storm which is produced by the endotoxin and ultimately causes multi-organ failure. Now, the effects of endotoxin: fever, hypotension, inflammation and disseminated intravascular coagulopathy. Now, enterotoxin are toxins secreted by the some bacteria that activate adenyl cyclase or guanyl cyclase enzyme within the cell of the small intestine and causes various diarrhea and diarrhea-like symptoms. There are some examples of enterotoxin. Some Enterobacteriaceae produce enterotoxin like enterotoxigenic E. coli, Enterobacter, Shigella, Salmonella, Citrobacter and Yersinia. And some non-Enterobacteriaceae which produce enterotoxin: Vibrio cholerae, Staphylococcus aureus, Bacillus cereus and Campylobacter jejuni. Now host defense. Barriers, first line immunosystem, innate immunoresponse, complement, macrophage and cytokine, then adaptive immunoresponse, specific B cell and T cell. This is the ultimate host defense of the bacterial infection, where the complement pathway activated and produce different type of cytokine and other polypeptide by neutrophil or macrophage, and ultimately causes several effect and ultimately causes cell mediated immunity and antibody mediated immunity. That's all about bacterial pathogenesis and host defense. Thank you all.